anatomy video for the hip and pelvis. So we're going to start with the bones. The femur is the longest and strongest bone in the body. It's designed to permit maximum mobility and support during locomotion, so when we're walking. Now it's going to fit here in the acetabulum into the pelvic bone, okay, one on each side, and then we have the sacrum in the middle. Okay. The pelvic bone is divided into the ilium, which is the brown area, the ischium, which is the green area here, and the pubic bone, which is the pink area here. You can see from this picture that there is the pubic symphysis here, and then the acetabulum on either side. And these help with the joints. We'll get into them as we go through. So the articulations, the hip joint itself, quite a comprehensive joint, very difficult to dislocate. The hip socket itself faces forward, downward, and laterally. Okay, so this is the socket off of the ilium. The femoral head is a sphere, and it fits into the acetabulum medially, upward, and slightly forward. Okay? And then you have the glenoid labrum that surrounds the rim of the acetabulum. It deepens that capsule, so it's going to be like your hand coming out and grabbing your opposite fist, holding it in. You can see from this picture the ligaments that hold this joint secure. Okay? There are three. Okay? I'm not going to ask you to identify them because, quite honestly, they're coated in the middle of your body and you wouldn't be able to ever palpate them. But you have the iliofemoral. So this is going to run from the ilium to the femur. Okay? It's also called the Y ligament of Bigelow. It's the strongest ligament in your body, and it prevents hyperextension of the hip. It also controls external rotation and adduction of the thigh. Okay? Then they have the pubofemoral, so it's going to run from the pubic bone to the femur. Okay? It's going to prevent excessive abduction. And then you have the ischiofemoral, which is going to run from the ischium to the femur. And this is going to prevent excessive internal rotation and adduction of the thigh. Okay? On top of all of this, we're going to throw the blood supply, the nerve supply, and the muscles. So the blood and nerve supply, these are the same pictures from the thigh. Remember, in the back, we have the sciatic nerve. It's the largest nerve in the body. Okay? And that runs on the posterior aspect. And then in the front, you have the femoral nerve. And it's going to run down through the femoral triangle, which we'll cover in lab. A, again, is the arteries. B is the veins. The thing to remember here is that right through this area, so the groin area, it's called the femoral triangle, and you have the femoral artery right here. The femoral artery can cause a deadly bleed in 5 minutes. So someone can physically bleed out enough of the blood in their body that they would die within 5 minutes. So any cuts or lacerations to that area can be deadly. When we get into the muscles, we've already looked at the thigh muscles, so the quads and the hamstrings, so we're going to concentrate more on the ones that cross into the hip. Okay? So on the anterior surface, we have the iliopsoas, and the iliopsoas is made up of two muscles. We have the psoas muscle here. It comes from the front of the vertebrae and the lumbar spine, and it comes through and joins with the iliacus muscle, which is the muscle here on the inside of the ilium. They come together and come and join onto the femur. So this is what's called your hip flexor muscle. Its technical name is the iliopsoas. Okay? Then you have many of the muscles of the thigh that are actually going to attach on to the pelvic bone as well. Okay? So you have the tensor fasciae lata here that comes down to the IT band, and the other muscles of the glutes. The glute max is the largest muscle, okay, the big huge bum muscle. If you go upwards in a fan shape, you have gluteus medius. Okay? And then right on the side, you have gluteus minimus. Okay? And we'll go through them in lab so you know exactly where to find them. When you take this layer of muscles off, you have the muscles below. Okay, gluteus medius, like I said, you can only palpate him right on the side. Okay. Piriformis, most people are familiar with the piriformis muscle. The thing to remember about the piriformis muscle is that it is an external rotator until you get to 90 degrees of hip flexion, and then it becomes an internal hip rotator. The other external hip rotators we have are the gemellus and the obturator group, and they are located right through here. Okay. The other thing that you need to know is that there needs to be a balance between the medial and lateral, the anterior and posterior muscles of the thigh. In a minimum, you need a 60 to 100% ratio hamstrings to quads. So that means that if you can push 60 pounds with your hamstrings, you need to be able to push 100 pounds with your quads in order to keep balance at the knee and at the hip. The other thing to remember is the fascia component that occurs here. And the main thing we're talking about is the tensor fascia lata that runs down the side. So this is a relatively thick band anteriorly and laterally, okay? But it tends to be thinner as it comes more medially, okay? The thing to remember is that gluteus maximus here attaches to the IT band. This picture shows you a cross-section in through the glute. It shows you where everything is located. It shows you the size of the different components that go through. Then we have the movements. Okay, so we have hip flexion as you bring the hip forward, hip extension as you bring it backwards, adduction, you're bringing the leg in, abduction, the leg is going away. Internal rotation is when your knee comes in and your foot goes out, and external rotation is the opposite. So your knee is going outwards with your foot coming in. And we will go over those in the lab.